There's been a recent rise in measles cases. Specifically, more cases are popping up in Texas and New Mexico. Roughly 100 cases have popped up since the start of the year.
Yeah, Dr. Payal Kohli is joining us now in the studio to talk a little bit more about this. Dr. Kohli, good morning.
Good morning.
First of all, remind us what measles even looks like, what it is, and who typically gets the measles.
You know, it's surprising that we're talking about measles because here in the United States, it was considered eradicated in 2000. So personally, I went to medical school after that. I've never seen or treated a case of measles as a physician, and I think most of my contemporary colleagues would say the same. But it's a highly contagious respiratory infection. So you catch it much like you would catch the flu or COVID, and it can cause pretty serious complications. It's not just a simple cold. It can cause blindness, brain swelling. 3 out of 1,000 kids will die from respiratory or neurological complications. Now, it can affect anyone at any age, but the people that are most likely to get the most severe complications are the younger and the older people.
Is the rash the most significant sign that it's measles?
It's a telltale sign, so
Okay.
It's called cough-like spots, and the way that it presents usually is with the 3 C's. So cough is one of them, coryza, which is nasopharyngitis, congestion, nasal congestion, and then conjunctivitis, and then you get this classic spots on your tongues. Now, measles is usually associated with very high fevers. I'm talking like 104. So again, it's kind of respiratory infection that has a lot of complications, and people who are not vaccinated have about a 20% of people who are not vaccinated will end up in the hospital with measles due to complications.
From contracting the virus, how quickly do you typically see symptoms present themselves?
So within a few days. And again, those fevers and stuff and the spots are really the telltale signs of the infection. We don't have a treatment for measles either. So we essentially just give supportive care, get people through it. But what's really scary about the measles, it's not just the acute complications, the blindness, the deafness, the brain swelling, the pneumonia. Many years later, 20 years later, you can have seizures or problems from measles as well if you've had involvement of the central nervous system or the brain.
Wow.
So these cases that we're seeing in Texas and New Mexico, should we be at all concerned here in Colorado?
You know, measles outbreak anywhere is a measles outbreak everywhere. And just like we saw with COVID and with other infections, it can get on a plane and come over here. It's highly contagious. And in fact, it lingers in the air for 2 hours even afterwards. So let's say you've never come into contact with a person with measles, they sneeze,
Right.
They leave the room and you come into that room or that airplane or anything afterwards, you could actually get it. And every person that has measles is going to give it on average to 9 to 10 other people. So that's that exponential growth that we're talking about. Remember that number R naught that we talked a lot about during COVID? One infected person is likely to infect 9 to 10 others that are not vaccinated.
Okay, talking about the vaccine, because I think most of us got the measles vaccine as little kids, right? How effective is that? Kind of effective for life? How effective is the vaccine in general?
It's an amazing vaccine,
Okay,
97% effective with 2 doses. Of course, the more infection you have around you, the less the efficacy works, right? The efficacy goes down because there's a lot of infection you can break through. But it's really great, those 2 doses, the one that you got between 12 to 15 months, and then the second is usually 4 to 6 years, usually protect you for life if you got that MMR. Now, if you're somebody who got vaccinated between 1963 and 1968, they were using an older vaccine, not the MMR, you may want to talk to your doctor about whether you should get an MMR booster just to sort of get your immunity up to speed now that we have measles here in the United States.
I have a quick last question for you. Has the measles vaccine changed since we got it as kids so long ago? And has the measles changed as well in terms of how it develops since back then?
It's an incredibly stable virus. So unlike COVID and flu that are always mutating, this is the same virus. That what's changed is the people getting vaccinated. So by not getting vaccinated and really low MMR vaccine rates, we've woken up the virus to start to spread. So the virus hasn't changed, it's our behavior. And we can really put it back at bay by getting vaccinated. So if you're someone who didn't get vaccinated or didn't get your children vaccinated for whatever reason, now that it's here, go and get them vaccinated.
All right, Dr. Kohli, we appreciate that. Thank you.
All right, you can find all of Dr. Kohli's appearances on mynews.com/Dr. Kohli.